Depending on the technique we use for browplasty surgery really depends on the length of the recovery. More invasive techniques take additional time to heal, and so a patient that undergoes a technique with an incision line either in the natural crease of the upper eyelid or above the eyebrow would take less time to heal than someone that had a full forehead lift. And so we'll talk about internal browpexy first. And internal browpexy is a procedure that's performed through the natural crease of the upper eyelid to lift the brow and stabilize the brow in a more elevated position. Recovery with an internal browpexy procedure takes approximately the same amount of time as a blepharoplasty alone. Patients can expect to have a little bit more tenderness in the lateral 2/3 of their brow. It's surprising what you use your brow for: sneezing, coughing, smiling, animating your face. All of that you utilize your frontalis muscle, which is the muscle we work around during that procedure. And so some patients experience tenderness in that region for up to 2 to 6 weeks. In terms of a direct brow lift, an incision line is placed in the lateral 2/3, above the lateral 2/3 of the temporal brow hairs. And that incision line, patients can expect to have redness in that incision line for approximately 3 to 6 months following surgery, and so sometimes camouflage makeup is necessary. Typically, though, patients experience whitening of that incision line within that 3-month time frame, and if we're able to place that incision line in a wrinkle line, it tends to heal very nicely. Ointment is placed on the incision line for 3 times a day for the first week following surgery, and sutures are removed 1 to 2 weeks following surgery.